Please can you remind me if you'll be so kind, staring out into space, asking God to hear my case, trying to think of all things past. How long will my memory last? The purple angel, purple angel, purple angel, you're next to me.
Well, hi, everyone, and welcome to Alzheimer Speaks Radio. I'm Lori LeBay, the host and founder of Alzheimer Speaks, and I'm also the daughter of a mother who lived with dementia for 30 years, and it changed my life, and that is why Alzheimer Speaks exists today. Our goal here, for those of you that are new to our show, is basically to raise all voices, and Alzheimer Speaks is, bottom line, an advocacy-based company providing multiple platforms to shift our dementia care culture from crisis to comfort around the world. And we also help companies expand their brand footprint by leveraging our content to increase access to products, services, and tools to those in need. And there are many, many people needing information, just like my family did. I want to thank all of our loyal listeners. You guys have been so great. In fact, we just found out we were in the top 10 podcasts for Alzheimer's. I think actually we were the original ones. We started back in 2011 or so. That's what people have told me around the world in terms of focusing on dementia and how we give care and being inclusive, again, of all voices. So your likes, your clicks, your shares with your Facebook friends, your Twitter tribe, your LinkedIn colleagues, whatever circles you may be in, again, I just thank you so much, because the more information we can get out to the public, the more comfortable someone feels grabbing it when they're in need. Now, today on the show, you can always call in if you have questions or comments that you'd like to add to the conversation at 323-874-4602. That's 323-870-4602. And you can always go to our main website, alzheimerspeaks.com, where you can connect to all of our initiatives and find out information on keynotes and trainings and our social media platforms as well. Let's see, what else do I have on my plate today? I have to talk about the Megathon. I went out to Washington at the Microsoft office for the Stall Catchers Megathon. Now, for those of you that aren't familiar with Stall Catchers, it's way cool. It's a game that was developed by Eyes on Alls, and it's actually a game that is free to anyone to play, but we actually get to analyze real-life data. And they were hoping on Saturday to get 100,000 people to play for an hour, and they projected in that hour's time they would save 1 year in research time. We had some technical difficulties, so that didn't happen. But again, you can play anytime, and I'm hoping that they're going to do these team searches on a regular basis there. So go to stallcatchers.com and sign up and help push research forward. The other thing that I want to mention to you is Dementia Action Alliance is having their second North America Dementia Conference, June 20th through the 22nd in Atlanta, Georgia. And what I love about their conference is the majority of their speakers actually have dementia. And so you are hearing from people living and breathing with dementia and how they would like to see the world react and deal and provide them comfort and care so that they can still live purpose-filled lives. Last, I just want to mention a couple of upcoming events that I have that are free and open to the public. This Friday, April 19th from 10:30 to 12:30, I will be at Gable Pines in Vadnais Heights, Minnesota, and I will be doing a program called Dementia Care is Changing Are You? And then on April 26th, I will be back out at Gable Pines again. That's also a Friday from 10:30 to 12:30. We're going to be talking about the realities of dementia and family-friendly tools and tips that can help. So I'd love to see you come out and join us if you are in the area. Now, today's going to be a really special program. The woman that I have on today is so dynamic, and I have not met her in person, but I've had the opportunity to talk with her on the phone several times, and I just so enjoy my conversations with Dr. Linda Bane Frizzell, who is with the University of Minnesota's School of Public Health. Dr. Frizzell has extensive experience in practice as a provider and administrator with Indian health systems. She holds a doctorate degree in physiology, education administration, and gerontology, and a postdoctorate in epidemiology. Her endeavors have included a broad range of professional preparation, both in medicine and also in education. She is totally dedicated to improving the quality of life across one's lifespan. So welcome, Dr. Frizzell. So thrilled to have you with us today.
Well, thank you so much. I'm so honored to be invited.
Well, you are just a bundle of enthusiasm, and I just love your resilience. You just keep charging forward with your beliefs, and I think we need more people like that. Now, before I start on our regular line of questioning that I've outlined, I always like to ask our guests if they've ever been touched by any form of dementia within their own family or circle of friends. And if you're not comfortable answering that, that's perfectly fine as well.
Well, I can't really say whether it's dementia or not, but my mother had some memory loss issues, but I could never determine whether it was on purpose or not after my father died. They were quite the pair, and so some of the lack of attention that she was getting or she felt she was getting, I think attributed to some of that memory loss.
Okay, great. Now, can you tell our audience what are some of the general awareness needs for memory impairment and loss that you see that communities need?
Well, generally, we tend to forget about the multiracial environment that we live in, multi-ethnical, and then the differences between our communities, in particular the subcultures within communities. There is, honestly, no two communities that are exactly alike. And so it's really important that if you're going to do a program within a community, that you consult with those stakeholders and listen to them, because the attributes and resilience are quite different, and it needs to be something that the community has chosen to do, whether or not they're ready to talk about some or not. So that's important. The other thing is, at least in our state of Minnesota, it would be great, we don't currently have it, but a consistent, valid memory loss through statewide messaging and awareness to contribute to risk reduction. And then my next area, Lori knows quite well, I worked for the state of Minnesota for about 5 years at a residential facility where we had different diagnoses for folks, but they're all incarcerated. Basically, folks that could not be kept in a mom and pop nursing home. And what I would like to, and I'll discuss this more too if people want to hear, but I have found that using the A word, and whenever I use that in committees, people go, huh? I go, no, think about it. The A word, Alzheimer's. And in the populations I've served over the last 25 years, it's a death diagnosis. And so the stigma that goes with that actually prohibits people from seeking services whenever they start to develop memory loss. First thing they have to understand is memory loss is not a normal part of aging. But the stigma and the fear of people, I mean, it's worse than a cancer diagnosis. And sometimes, it could be something as minor if they were to seek professional help, at least in this time of year in Minnesota because it's so dry, of dehydration causes memory loss. More likely than not, with elders with the multiple medications that they take, there may be some interaction between that, and that needs to be reviewed. But it's not a memory loss issue that's due to anything long-term like dementia or other types of memory loss issues. The thing that I really like to stress is the fact that, and I teach a class in this semester, is in cultural humility. And we have to understand and respect that every individual has their own culture. Just a second, something beeping on my phone. Anyhow, the thing is, if you don't practice cultural humility, you're going to be hard-pressed to provide any sort of valid service to the people that you're working with. And cultural humility starts with just by acknowledging the individual and to be respectful of what their wishes are. Also understanding that even within families, there's different subcultures that affect. So using cultural humility is an absolute basis. And then lastly, in this particular topic, it's really important to facilitate some sort of awareness of access to needed care and services, especially for those with limited access. And I was born and raised rural. I work in Minneapolis right now. Oh, it's a stressor because I am a rural person. And so my home area is in the north central part of the state. And we've done research up there, meaning the university. And sadly, now this is probably about a 25,000 population service area. We have one provider that has the ability to access or to assess memory loss degrees and impairment.
Oh my
that's
gosh.
not good. Yeah, that is absolutely not good.
That's just shocking. I mean, I don't think any, there's so much that we don't know and that people don't know in general until they need a service. And then all of a sudden you find out it's not available, or you find out maybe after the fact that services were available, but you didn't even know what they were called or where to go to. And all of that just needs to change. I love when you're talking about the cultural humility. I think we've lost that as a society at large. Our ability to be apathetic and to be respectful, and we seem to be on this my way or the highway type thing. And healthcare in some ways has come a long ways, but we need to go so much further in terms of training and development with all of this, with our families and our professionals alike with that. The other thing, you had talked about the stigma of the A word, using the word Alzheimer's. But I know that you've got some feelings like with dementia and the word cognitive as well, because a lot of people don't know necessarily what those words mean or what they infer, and everyone kind of wraps them up in a little different package when they're speaking. And so I'm with you. I think we have to speak in the people's language and not convert them to the medical language. That we need to use whatever they're comfortable with in hearing. Otherwise, they're going to block it all out. And like you said, they're not going to reach out for help or support that might be there, for them. So those are wonderful points. Thank you so much for sharing those. Anything else you wanted to add in that area, Linda?
Well, in regarding stigma, I'm of the elder age, and I just remember that whenever I was a youngster, first of all, I was taught to be seen and not heard, which at the time I thought, well, that's a bummer, but it did seem to work out okay. But even in regard to the word dementia, for my age group and older, those individuals were slangily referred to in communities as, quote, demented. So even the term dementia has a negative connotation. And why should we use words like cognitive whenever we could use terms like knowledge, which everybody understands? I just think it's important, and preventing memory loss is such a benefit if we can reach people that'll seek professional help. We just shouldn't throw up roadblocks or stigma in regards. Some cultures actually have issues with people who are experiencing memory loss of whatever degree. And so we have to be real careful about that too. But I just want everybody to be able to access and participate in the best care and services that they can. And I hate to see words that negate that.
Yeah, and I think sometimes we're not all that sensitive. We kind of jump in and go, this is what's used. And I know as a community at large, when I talk to people around the world, dementia seems to be the word that's bubbled to the top, even though it has, the connotation of being demented. I think through education, there's been more understanding. And what I hear from people with dementia and their families nowadays, and you may be hearing something different, so I'd love to hear that. But what I'm hearing from them is bottom line, stop screwing with the words. Let's just stick with dementia and let's get on with services that we need in a cure, because we're never ever going to please everybody. And so that's kind of what they're saying, is stop fighting about it. They were very irritated when it was always referred to as Alzheimer's, because many of them had different types of dementia, frontal temporal lobe, vascular, Lewy body. Didn't make any difference. And they said, there's more similarities between them all than not. So pool it and, make this umbrella understanding and just do more educating so that there's not as much fear. What are your thoughts on that?
I agree. I agree. That's where we have to start. And my experience in even working with youngsters in K-12, if they explain what the illness is, the situation, the other children who may have a condition don't get bullied. And right now in our society, bullying seems to be widespread. And any excuse to do that, to show that somebody's different, is not something that we should be promoting. So I agree. There's other language. The other term that I've never heard recently, and my great-grandmother was, quote, said to have this, but she had hardening of the arteries. That was a term which it seemed to be accepted. And it's like, okay, well, then this person needs to have support, or would generally be dependent on others to provide services. So, like I say, words are everything. And whenever anybody works with a community, it's best to find out what those acceptable terms are, because it may be different. It may shock you. But in the same sense, if you practice cultural humility, you will ask, and the community, if they choose to, will step up and share with you. But that's why I say the terms are just a big deal. But we can start to educate people in that too, as you suggest.
Yeah. Well, like you said, asking the right questions and then listening and then actually incorporating what you've heard into, the information. Senility was another one. And some people have talked about, well, let's just call it a degenerative brain. And then there's another side that says, no, people will misunderstand that too. And again, we just need so much more education out there and interactive pieces so that we are hearing from families and people diagnosed of what it's really like for them in raising their voice. What are some of the methods that you think we can use to reduce the risk of memory impairment or loss?
Well, I think being an old educator, old being the operative word, I am really a proponent of education. And I'm suggesting education in all levels of life. And, oftentimes our first responders, at least in rural America, are the best that we have to help emergencies. We don't have a big enough population base for paramedics, but they need to have some training. Law enforcement certainly does. Town councils, public safety councils, K-12 schools, which is my favorite because I've seen such good things that are done in K-12 where the youngsters actually provide their parents the attributes of the education that they've learned in the school setting. And what a better place, that's the first round of defense is in our K-12 schools and the teachers. And so just so much that we can do through education, but it has to be general enough that it doesn't alienate people. And it has to be responsive enough that people feel comfortable in asking the questions. I know I'm not sure which agency in Minneapolis, but they just have a memory loss department. I'm like, well, everybody knows what that is, memory loss, and it is not confrontational. People need to understand that, if they observe their family or somebody, talking all the time and chattering and repeating the same thing, that might be a problem. But to feel confident to seek professional help whenever they start to show symptoms. The public doesn't understand what the signs and symptoms are for memory loss, and that would be really helpful if we could do something like that.
Yeah, that would be great. When you were talking about the kids, I too think they are so powerful. I mean, I believe they're the ones that have gotten a lot of adults to stop smoking and wear their seatbelts, because they came home and said, and all of a sudden there was an emotional attachment of why to do that. It's not for yourself now; it's for your children, and a bigger picture. And I think that they can elevate the knowledge, because their innocence and their acceptance is so grand, and it makes you look at things different, because they have a wider brush. They haven't been told it's this way or the highway. There's only one way to do it. I think they're just a lot more fluid in terms of their thoughts, and open to having things smooth and connected, and they see and they feel the differences when dementia touches their family in any state or form, whatever word you're going to use for it, and they want to help. But a lot of times I think families think that they're protecting their children by not putting the burden on them, but they're full of energy and ideas, and they want to help, and now the whole family is shifted and they don't really know why. And so it's very interesting to see that impact and to be able to empower them with knowledge. I love that idea. What do you think about, the saying is, what's good for the heart is good for the brain?
Well, I'm an old physical education teacher, and so I have all sorts of thoughts on good cardiovascular health. But actually, for my dissertation, I actually had subjects which had memory impairments. Some had premature diagnosis of Alzheimer's, some had organic brain syndrome, a few had Huntington's chorea, and so on. But the point being that these folks knew what they had, but to be diverse enough to be able to provide services. And so I did a life satisfaction survey. My whole intent was to prove that no matter what age, you could gain strength. And they did, and to a significant level. And so it's important that people, the other adage is, if you don't use it, you'll lose it. And so just stimulation, mental activities daily is important. That's why, the link that I see between elders and youngsters, I see such a benefit for both. In some of our tribal schools, we actually have elders that come in and work with the teachers, and especially in the area of language. And a lot of tribes across the country have lost their language, but with the help of the elders, they've pieced it back together. And what I see, it's just almost a growth overnight in what the elders are receiving. The kids come in, they hug them, and they talk to them. They're so proud. In the same sense, the children are so proud that is their grandma or grandpa. And so I just think, that we need to keep people physically active. I think there's issues right now with nutrition, specifically nutrition safety. I think there's also some very high concerns that I have of the environment. And I say that kind of reluctantly to your audience. But in the School of Public Health, I have access to a lot of resources. And they have found in the environment, particularly the Great Lakes, all of them, and all of our lakes in the state of Minnesota, a residual birth control component. And I'm like, oh my gosh, in the Great Lakes they can detect it. In our small lakes they can detect it. Well, you think about what the trickle-down effect of that is, the vegetation, the animals that eat the vegetation, the animals that eat the other animals. I have real concerns about that. And so I think there's things that we need to realize that happens in our environment which could very well, we don't have any, I'm not aware of any studies other than just general ones that address that issue right now. But it's on our radar, and we're trying to see what that impact may be. Can we as human beings evolve to protect ourselves against that? Back whenever I was in graduate school, people were throwing out their aluminum pans because, there was detected aluminum in brains of people that postmortem had Alzheimer's disease and some of the amyloid plaque and so on. And now that's all kind of being dismissed because it's like the chicken or egg, did this happen because of, or was this there already? So I'm very concerned about our welfare, being able to maintain healthy cognition and mental purposes for everyday life. And that's what I think is a challenge today.
Yeah, you're right. It's so hard to know, like you said, chicken or the egg, what happens first. And you talked about you don't use it, you lose it. And I'm going to be 60 this summer, and it's like, oh my gosh, I sit in front of my computer and I have like lost all my muscle mass, because I just flop and I keep spreading, and it's like, oh, I've got to get out. And I'm so glad it's nice. It's like I've got to get into a routine that allows me to move. And I have this horrible mentality of, no, I have to get this done. I have to get this done. And I've got to make it a priority because I'm really, really noticing the differences with that. And I know I'm keeping my brain active by, doing a lot of things and multitasking, though they're saying multitasking isn't so good anymore. You're better off just doing one thing at a time and making sure that we get, that 7 to 8 hours sleep every night, which, a lot of people weren't doing that either, and eating healthier and in smaller bite sizes, and then, keeping those liquids, keeping hydrated. So many people I hear, especially as they age, stop drinking their fluids because they're afraid they're going to have an accident. And then on top of the medications and stuff. And so you're right, there's lots of different things that can cause symptoms of dementia, but some are curable, could be, vitamin deficiency, all those types of things. Linda, what types of platforms and methods and procedures do you think need to be considered to support the messaging of a healthy lifestyle with someone who is dealing with, some kind of a memory issue or dementia?
Well, I think it's really important that you be responsive to the individual. And, it may or may not be the choice of that individual as long as they are able to be responsive and not to be determined to be mentally impaired as to whether or not they want the family involved. In some situations, the person, they know if they're having memory issues before generally anybody else does. And so oftentimes they're embarrassed. They don't want the family to know. That's where I had mentioned they chitter-chatter and just ongoing over and over again thinking that they're camouflaging, that they're having memory issues. And so I think the second area in education that would be really helpful is to provide the family members, if the patient decides that's appropriate, for support for their stress and to talk about, what is stigmatized within their personal culture and subculture, and determine in the community, what the interaction may be. There may be no resources. Understanding that the entire country, with the exception of a few metropolitan areas, is a mental health provider shortage area. Huge issues. And we don't have time to go on that today, but it's generally because of lack of reimbursement. But anyhow, for family caregivers to understand, they can be helpful. Such things as, reminding somebody where their room is, reminding them to pick up their fork, and then say, oh, pick up your fork a couple times, to remind them, just to make sure that it isn't embarrassing to the person. But these are things that have been effectively used over the years. And one thing I was going to add to on the physical activity, there has been research done in regards to the O2 exposure of the brain, and that seems to be the difference between cognitive duties in regards to able to continue. It seems to flush it out more, seems to be a benefit. Oh, and by the way, they do have treadmills with computer screens on them.
Mm-hmm.
So if you want to be really active, get on the treadmill, do your computer work while you're walking on that. But those are the main things, I think, in regards to that.
Yeah, I think when you're talking about the stigmas and reducing the stress for families and the person diagnosed, I think it's really important to get them on the same page and understanding. You know, I go around and I speak around the country, and people are just shocked at how simple of techniques can be used. And part of it, I think of what I do, I think a big actually portion of what I do is get people to look at the disease differently. You know, it's just one more disease that we have to adapt to. We've adapted to AIDS and cancer and heart disease and diabetes and all of those things where we can have open conversations and there's not embarrassment. And we need to get all parties together to have the conversation so that we can really figure out the best possible plan to be able to engage. I think, you know, one of the biggest things is to help people focus on the abilities that are still left, because we're all changing. You know, I'm not what I used to be, you know, on a lot of levels, but I'm a lot more on other areas too. And so is a person with dementia, and in focusing on the understanding that not everything is gone, and sometimes we take things away because it's easier on us than to give them dignity of being able to participate in some way. And when we consciously kind of slow down and think about how we're caring, I think that can also alleviate a lot of guilt for families when they feel that they haven't given the best care. You know, just, I don't know, just slow down sometimes and just think about how would you feel, what would you like, and then have that conversation with that person. It doesn't have to be difficult. It's just, you know, it's just listening. Mm-hmm.
The one thing that I've noticed is the most difficult, and sadly, our male pop elders doesn't seem to be a large group of folks, but there is huge implications from male people with memory loss and stigma within a family. And if you stop to think about, you know, oftentimes it's the male who is the head of the family. And for them to even ask for help, they would never do that. And so there's ways and techniques that providers can do, including the family, to make and help the person so they aren't embarrassed whenever they do need help, and to maybe have a code or something. There's lots of different techniques whenever they need something to ask somebody within their family they can do, and so nobody else knows. I mean, providers have to be as crafty as what the people are from hiding their memory loss issues, and it's a big deal.
That's a really good point, because they can hide it. The other thing is, you know, a lot of times, and I hear this over and over again, when people go into the doctor, you know, they get their diagnosis, they get another appointment, and half of them don't get any resources at all, and they're always told to get their affairs in order. And I think the way we look at our legal affairs, you know, every child who turns 18 should have a power of attorney. You know, this is not something that is just needed in old age. We could be in a car accident or have some kind of health issue or be attacked or whatever, where we need that backup. And we don't have these conversations at an early age. It should be just good, the good business of living life well, being smart. And instead, we've wrapped it in this package of fear and said, no, you really don't have to look at that until you really, really need it. You know, well, no one knows when they're really, really going to need it. And I think that would help to reduce some of the stigmas and make us all more equal at any age, because we don't know what's going to happen to any of us at any time.
Well, and once adults become vulnerable for whatever reason, that makes it wide open, and it just saddens me some of the predatory things that people do now to our elders, and some have had their life savings stolen from them. I mean, there's just horrible things. Adult abuse is rising, unfortunately. So real concerns about that and protection. You know, our social services within our counties, at least we have counties in Minnesota, is an issue. But that's one thing that can be very embarrassing because rural people do not, quote, accept public health. That's demeaning to them because it's deemed to be welfare, and we don't need welfare, quote unquote, and it goes on and on. And so that's another sensitive area. But this vulnerability of adults, I think, is going to get much worse before it gets better, given some of the technology scams that are out there now. I've had my identity stolen once, and it's just awful. And understanding that, you know, other people that may have some cognition issues could be very easily scammed to, oh, well, we just need your Social Security number, and we'll send you whatever. I mean, that happens all the time.
Yeah, I had a good friend whose mom had that issue, and she was living in a senior community with a bank in it, and the daughter had talked to the bank. You know, she was power of attorney, and they said, well, until she's pulled off the account and it's not in her name, she can come and get as much money out of here as she wants. And, you know, they were trying to be respectful of the mom, and she got taken over and over and over and over again. It was just ridiculous because she'd get on the list of the scammers, and then there would be another one, you know, that would come. Yeah, it's bad stuff.
Yeah.
Why do you think it's so important to address the well-being of individuals in a real comprehensive manner, Linda?
Well, general wellness and limits on risky behaviors. And we have some data on risky behaviors, not only from our youngsters with the CDC's Youth Risk Behavior Survey, but with the same survey that's provided to adults. Sadly, nobody meshes the two between. But the adult, it's called the BRFSS, Behavioral Risk Survey Factor, forget now what the SS stands for, but regardless, you know, we need to really look at what those risky behaviors are, because that makes a huge difference. And so if you're living a life where you know you've got some memory issues and you're also practicing risky life behaviors, as you suggest, you know, with not having mechanisms built in for bank accounts and things like that, it is a big deal. And the knowledge that we need there and support for you know, knowing what those risky behaviors are is really important. What I did for my mother in later years is I visited with the bank, and I had on her checks. At that time, she didn't have any credit cards or didn't use them, and I put maximum limit $300. Well, that slowed down a lot of people, and because you know $300 is hardly worth the aggravation if you get caught. And so there's other techniques that can be used, and that's something I think that your organization could help people to understand, just some of those safeguards before, you know, they've been abused financially at least. And then just helping people to learn, be aware of what the services and resources are for that vulnerability and how to be safe in their communities. The county where I live up north, they actually put out an awareness pamphlet, actually as a little manual, and it provided all the information where elders could seek help, and it had all sorts of lists of things. I just wish that on TV, some of our PSA public service announcements, we could do similar things like that, but nobody does. And so, especially in rural communities, I mean, people that go to church may see each other on Sunday. People that live so far out that it's a hardship to get to any habitated area. I mean, these are big deals. And so to be able to help people understand where they can go, maybe they know they have memory loss. Well, where do you go? I'm telling you, where I live up north, it's like one place. But regardless, there's other events within, and I live on a reservation, but whenever we were visiting earlier, most tribes have elderly nutrition programs, and they have congregate meals. Some of the meals are delivered to the homes. It just depends on the person. But, there's generally in these small little villages a area where the meals are cooked and prepared, and would be a perfect opportunity for networking there with each other just by themselves after, they had a little bit of facilitation to develop that. But groups of folks, and I know, Lori, you and I have talked about memory cafes, I think that is the best thing ever. And to help people to be more relaxed, and you got to talk about it. If it's already stigmatized, by talking about it, you learn ways and you learn coping mechanisms to deal with issues. And I just think that's just the best thing ever.
Yeah, the ones that I've been involved with have been, we thought we were going to do a lot of programming, and we were going to, have the room all ready and set up, when they got there, because that's what you do. And then we found out, no, that, when you go over to a friend's house, you kind of help, you hang out in the kitchen. What can I do, to help push things along? And people still wanted that. So we stopped putting tables together and let them be part of that, because that made them feel good. It made them feel part of the group. We found that they really didn't want to be talked to. They wanted to talk with. They wanted to build a sense of community and have that peer interaction. So, the ones that I do, I say, dementia brings us together, but it's kind of like a bowling league or a bridge club. You don't show up for the equipment. You show up kind of for the giggles, and the friendships. And so we talk about everything that's going on in people's lives. And, within that, dementia comes up, but it doesn't take over. And so sometimes I leave after two hours and my cheeks are sore because we've laughed so much, and that is so healthy, because people forget to have fun and to lighten up. And, it's just about learning how to adapt. And I mean, they've shared stories that they've never told any other family members or friends, but they've discussed them in that group. And it's like, what a release and a relief. And then other people can come out and say they've never shared it either. And it's just, it just relieves that pressure valve and makes people not feel ashamed or alone or any of that. It's nice to have peers. And that's really what that group is about. It's about developing community. It's not a stringent, group. One of the things they said is, we don't want an 8-week course, and then we're kicked to the curb and we got to start all over again. They stay a lot of times even after their loved one has passed, because they need the support from the group, and yet they still have so much to still give to people participating in it, because they've gone the journey and now they're in a different end, and they leave when they're ready to. It isn't a demanding thing. We've had people come to those groups too without a person diagnosed, because they're not ready to come, but the care partner comes and gets information, and then when that person's ready, they both attend, or vice versa. We've had the person with dementia come and their care partner wasn't ready to. We've played it very fluid to make sure that we're meeting our community's needs in terms of what it is they want. I think those rigid rules get us in trouble sometimes, but maybe I'm just a rule breaker. I don't know.
But Lori, you hit the most important phrase: to talk with, not to. And even whenever I used to see patients, even my students, I don't talk to them, I talk with them, because I can learn stuff from them too. The same thing with elders or any patient. And so that is such a key respectful factor. And, sometimes universities have a bad misnomer, and some of our federal agencies certainly do. They come in and do it to you, is what we refer to it, at least in Indian country. And we all know how well that works. But just talking with is a huge, huge deal. Granted, it takes more time. You can't go visit somewhere and wham, bam, you're gone, your lecture's done. No, that's not going to get you anywhere. But talking with is so key.
It is, and as a facilitator, I train other facilitators. Don't always answer the question. Let the group answer first, and then you fill in. You
Yeah.
know, you're a facilitator. You're not a trainer in this role, and there's a big difference. And then it really helps people, I think, get comfortable when they're sharing, because a lot of times people come in and go, well, I don't know, what do I know? I don't know anything, and it's like you've been on this journey, even if it's 2 months longer than Bob and Betty over here. You know more. You still have something to share, and they realize that, and people want to help the next guy, and we all, I think, have to get in the mindset that there's always more to learn, and that any relationship is a give and take. And if we go in being relationship based, that's exactly what happens. And these I mean, deep friendships are developed so easily and so quickly. And they say over and over again, "This is my lifeline." It's wonderful for all sides to be able to participate. I would laugh too, because some would say, well, you can't have them in the same group. A person that's diagnosed along with their care partner. I'm like, well, where the heck do you think they are the rest of the day? I mean, come on, get over yourselves. There are other groups that can meet those needs, but that's what I love about the memory cafes is they're pretty fluid. Some of them have activities, some do music, some go out on walking groups, and then there's others like ours that just want to sit and talk. There's one in Arizona where they just go out to a restaurant and they all buy their own dinner and they just socialize. It's just kind of a get together. There's absolutely no structure. You just show up and you sit and you talk with whoever you want to. And, so there's no right or wrong. It's just meet the needs, listen and meet the needs, and ask the question repeatedly. Is there anything we need to change with this? What do you want? It just isn't that tough. Doesn't have to be.
Well, and your model for within groups, you're the outsider generally, and one should never pretend to be the know-it-all. And what I teach my students in a cultural humility class is there is no way on earth I can teach you every culture in the world, but I can teach you methods. And so I suggest to them primarily whenever they do community gatherings, they have this background. We do from all over the world. We do New Zealand, Australia, Canada, anywhere, history and different cultural influences. And so I share with them that while you may be facilitating, the audience leads you, and you may ask probing questions to help elicit some of the information that they didn't know they had to make a more fulfilling meeting. But that's what they're there for, not to tell anybody anything, but to use their professional expertise to help empower that particular community.
Yeah. Well, and none of us want to be fixed or told we're broken. We want support. So again, using the language of even just switching from that word that we love to use. Oh, it's a behavior. With dementia, and I ask people all the time, well, what does that mean to you? Are you doing something good when somebody tells you that? Well, no. Well, how does it feel when you're told you have a behavior? And they're like, oh my gosh, I never realized how much we talk like that, and I tell them that, we're the ones with the cognitive abilities that haven't been interfered with. So we're the ones that have to look for the clues and the signals, so that behavior is just a reaction that says something's off. Something's not working for them, and they can't tell us any other way. And, to not go to the blame and shame, but go to how do we make this better, and take in all those senses of what's going on. Well, Linda, I can't believe how fast this is going. We only have about 10 minutes left, and I could talk to you all day. So I really want to ask, because I know you work a lot with the American Indian elders, and can you tell us what are some of their needs for cultural sensitivity in healthcare and in services? Because I think it's a very underserved population, and we need to work them in, and we need to do better. What can we do?
Well, I think it's important that the public understand where American Indians came from, and it kind of all starts, at least the written history, whenever our friend Columbus hit the shores. And at that particular time, it's estimated there's about 10 million American Indians within the lower 48 area, and by 1850, there was less than a quarter of a million. So that was a lot of folks that were killed. There's been bounty on Indians' heads for a lot of years, including the first governor of Minnesota. Governor Ramsey had a bounty on Indians' heads. And then there's other atrocities that happen, but what it amounts to is genocide, purposeful exposure to diseases like trachoma. Whenever the War Department was administering services for Indian people, basically where health services started, they contaminated them with trachoma just to see, how far it would go, and used them as guinea pigs. And it's throughout history, it's just awful, and people don't understand. And secondly, that there's 573 federally recognized tribes currently. Each of those tribes has their own constitution, and that sort of administration happened back in the 70s. But regardless, so each tribe has their own elected group of leaders, and people can enroll depending on whatever the criteria is for blood quantum. And the important thing in regards to health services, and I use the term services and care, I think it's important that we just don't focus on care, because that kind of negates public health and certainly negates behavioral health services. But anyhow, health and equity issues that we have are a big deal. So understand we have a limited time. I would like your readers to consider this, that each person that is deemed to be an American Indian, however they want to be defined as that and what their criteria is, they are a member of a family. Secondly, by law, they are a dual citizen. In other words, they're a citizen of the United States of America and a citizen of their respective tribes. Oftentimes, and I'll give you an example of my own family. I have 4 kids. 2 of them are spiritual for traditional, and 2 of them are Western religion. And so within families, you can have huge differences like that. And understand the language preference. There's only one tribe right now that has monolingual speakers left, and that's the Navajo Nation. But a lot of elders, whenever you go to the eating centers, are speaking their original language, and that may be of comfort to them. But ask what the preference is. Also, understanding that 100% of the American Indians in this country have historical, and that relates back to the boarding schools, and we still see that impact today because we have youngsters that are becoming parents, and they do not know how to be parents because their parents were in boarding schools, so they couldn't learn from their parents, and it just continues on. And so given all the genocide and forced assimilation, we have an entire population which may or may not have had fruitful experiences with health services. And the population is certainly apprehensive about seeking services in the public sector. And I can tell you personally that I've had some orthopedic issues. I get treated like I'm drug seeking to this day. And it just irritates me. And it's just this bigotry that's happening in regards to American Indians in this country is just awful. But I don't think people know the history. We don't want any concessions. Oh, poor you. No, we don't care about that. We want to be recognized on an equal status. And in my opinion, today we are not. Yeah. So those are some things to be sensitive to.
Well, that is wonderful. I do want to sneak one more question in here because I think it's so critical of why knowing someone's culture is so important in order to serve them, and then how to communicate with a patient or a client, whatever term you want to use. You talk kind of about that what I call multisensory piece, where it's not just verbal communication. Can you explain a little bit more about that face-to-face and body language and gestures and all of that, your thoughts there?
Sure. It's really important that understanding that each provider has their own subculture that they have been taught since they were able to observe things in the world. And so as a provider grows up, they categorize things differently. Everybody has that ability to do that. So if you're doing a visit with folks, they may be sensitive to touch. They may have to have a big space as proximity if you're visiting with them. There's issues with gender. Some people, females may not want to see a male doctor and vice versa. But it's really important to start to ask. Whenever the provider or you're doing services for folks, ask, is this okay to ask this question? Is this okay to visit with you while I'm sitting down? Understanding one of the biggest myths, well, it's sort of a myth, but whenever I used to hire primary care providers, they come to my office and they're complaining, the patient won't even look at me. I'm like, yeah? And they're just like standing there. I says, well, they're showing you respect. And so the eye-to-eye contact in a lot of particularly Indian populations, I don't know if it's from the history of being of having negative experiences with health providers, but they don't look at you. And I get criticized personally, and I apologize to my students. I say, hey, you don't want me to look you eyeball to eyeball because that means I'm ready to do something. But seriously, that's the way I was brought up, and it is disrespectful. So there's different things within, like I said, there's 573 federally recognized tribes, differences within all of those. And it's just simple to ask. If you approach or you say something and you see the person have kind of a squiggly or a wiggly reaction, well, maybe we better, research this a little bit more. And granted, you'll never get it in the 8 minutes so that you get to have with a patient, but sometimes you just got to break the rules.
Yeah.
And but it is so important that the provider knows their own culture, and then to respect others.
Yeah, and to listen, just to listen. Sometimes you go in and you're just being talked to or talked at, and people are like, trying to be heard, and when they feel disrespected, they're going to pull away. So, so much to learn. Well, Linda, thank you so much for being with us today. Dr. Linda Frizzell can be contacted at the University of Minnesota in the dean's office, and we've got all the contact information there, a couple of emails, phone number, and then address to write to. So please check her out. She is just full of knowledge, and you just have a heart of gold. I just adore talking with you because you're so conscious about keeping the playing field fluid and equal, and I adore that about you. I mean, you see the needs so clearly, and we just need to get more people to see as clearly and distinctly as you do the importance of respect and dignity for all. Because if people don't feel respected, we can't help them through this process. We can't help. We're just adding to their journey of stress, and we all know stress is not a friend to any form of dementia. It's really not a good form for any of us, period, from a health standpoint. Any last comment that you want to make? We got about a minute left.
I just really, truly, I feel honored to be asked to talk with you on this. And I love to mentor. I have a number of students that I mentor. And as an elder, it is my responsibility to help out folks to understand. And so I gladly accept that responsibility. And to everybody out there, just please, please, please do what you can to practice cultural humility, because it makes all of the difference in the world. Understanding that the age group that we're working with that has memory issues is a cohort of folks that would never, do anything wrong knowingly. So if they are in the wrong health plan and they go to see a provider, their old provider, they're not in the health plan, they're told that point blank, you think they'll ever come back? Mm-hmm. And that's the sad reality. And they were going to auto-enroll Medicare patients, and I quick testified to that deal, that people would rather self-terminate before ever doing something that was wrong. So it's a very proud group of people. They're very sincere.
Thank you so much. We've got to wrap up here, Linda, but thank you so much. Appreciate your time today.
You're quite welcome.
Bye-bye.
Bye now.
Hi, everyone. This is Meredith from the Senior Fitness with Meredith podcast, where I discuss all things for seniors, from fitness, your health and wellness journeys, how to be all over strong and beyond. I also have my mini podcast called Motivation with Meredith. It's a great, quick motivational pick-me-up for your days. Join me, listen now, search for Senior Fitness with Meredith on your favorite podcast platform.